So this question is for Cynthia. So I understand that you had this really, really great role in Spain, and that's when you were hit with this complex regional pain syndrome. So what has it been like dealing with chronic pain for more than 30 years?
It turned my life upside down and inside out. Actually, the nickname for my disease, CRPS, is the suicide disease. And as such, the pain feels as though my body has literally been doused with gasoline and lit on fire. And because for the first 13 and a half years of my illness, my doctors told me that my physical problems were all in my head, I was left bedridden for a decade and unable to speak for 5 of those years. So actually, it took me 13 and a half years to get a diagnosis. Finally, once I finally got it, I quickly realized that taking opioids was an excellent and effective way to manage my chronic pain. However, I have the severe side effect of opioid-induced constipation, also known as OIC. I also have this wonderful guy sitting next to me, John, who is my partner in every sense of the word. John is my, you're my husband, my caregiver, and it's been together that we have, all around good guy, together we have survived the symptoms, the experiences of chronic pain for the past 32 years. And after I realized that laxatives and natural remedies did not help my OIC symptoms, it was John who encouraged me to make an appointment to talk to my doctor about my OIC symptoms as well as treatment options. And starting that conversation led to relief. Thank you, John. And thank you, Deanna, for that question.
Sure, no problem. Okay. All right, I'm jotting all this down.
Oh, great.
Okay. Sure, yeah. All right, so the next question is for either Cynthia, if I can speak, Cynthia or John. Why is having a caregiver so vital?
Well, gosh, for me, it's a matter of life and death. I mean, everybody else left me, which is really a symptom of chronic pain, as everybody does leave. And somehow this amazing man stuck by me, and I wouldn't be here without him. Do you have anything to? How did you stay?
Well, I always say it's always been about love, and it's always going to be about love. But I'm telling you that sometimes love is not enough, because chronic pain is one of those things that can challenge every part of you, and it doesn't leave anything untouched, that kind of thing. So it's important to have a caregiver when you're experiencing chronic pain, because you really do need somebody to be in your corner, to really advocate for you, to talk openly and discuss things that are going on in your experience, because there's again, chronic pain touches every part of the human experience. Negatively, some positively, but most of it's a challenge. And you really want to encourage the person you're taking care of to seek out as much help as they can, to go to their healthcare professional or their doctor to find solutions to problems, or just to get the things out, to talk about some of these things like OIC, which, again, because of the nature of the problem, constipation, let's face it, it's not something we want to talk a lot about, because it's
not the first thing.
It's kind of embarrassing. It's something to be ashamed of, but you want to encourage them to talk about it. This is a very serious condition. It causes a lot of serious problems potentially, and so it can add a lot to the plate of taking care of somebody with chronic pain. So it's not only good for the person with pain, it's good for the caregiver to talk about, to try to find solutions to all these problems, including OIC.
That's true.
Yep.
Right, I understand. Okay. Yeah, this is great information. Okay.
Thank you.
Oh, good.
Thank you.
Great, Deanna.
Okay. All right. So this is for Cynthia. This is question 3. What are some of the daily struggles you face having opioid-induced constipation, and how does it affect your life?
First of all, being able to say it, like you, Deanna. When my pain is at a very high level, and I'm talking about a level 9 or 10 on a pain scale from 0, meaning no pain, to 10, meaning the worst pain you can imagine, I always have to make the very difficult decision of whether to weigh the choice of whether to take opioids and get relief, but also deal with the OIC, or not take the opioids or not get relief. When I choose relief, generally my pain lowers to about a 3 or a 4, which allows me to get a good night of sleep, and I wake up refreshed and ready to take on the day. But then I also have to deal with the OIC. And while all of John and my pain days are challenges, our OIC days are the worst. The straining for me has been so serious that I've developed a hiatal hernia, and the straining also very often causes the CRPS pain in my legs to shoot so high that I can do only minimal walking or no walking at all on those days. And so that means that for John, he as a caregiver has to not only be my legs for my normal everyday and work activities, but also get me to and from the bathroom time and sometimes time again, or bring that bathroom to me. So it's a supreme challenge dealing with OIC and pain, of course.
Right, okay. Minimal walking.
Yes,
Okay.
sometimes no walking at
Right.
all.
Right, okay.
Yeah.
Because the pain in your legs.
Well,
gets
because
so severe.
the straining causes the pain in my legs to shoot up so high.
Wow. Okay.
Yeah,
Right.
it's really severe.
Okay. Pain in legs. Okay. And what, as a quick thing, you said it was what kind of hernia did you say it was?
A hiatal hernia.
Oh, that's right.
H-I-E-T-A-L.
Yeah, hiatal
And that's
hernia.
actually why I wasn't able to speak for 5 years, and I lost my singing voice for 15 years as
Literally
a result
from
of that.
straining, I learned this recently, you're literally pushing your stomach into your esophagus, and that's the that's the
Yeah.
hernia part of it. And,
Talk about pain.
And it's once you have a hiatal hernia, it's for life. And
Well,
it's,
see, and then that spread my CRPS disease, and it's just,
Yeah.
you don't want OIC.
yeah, do not.
Yeah. Yeah, it's not just, well, it's difficult to go, it's actually a whole entire host of things.
Yeah, I mean,
Absolutely.
OIC is not normal constipation because it's caused by the opioids. So for me, at least, it's a far more difficult problem to manage.
Yeah. Yeah. Because I completely.
Well,
hear you.
your system just shuts down. You literally, I know another woman in pain who ended up in the hospital impacted so many times that at one point her doctor just threw up his hands and said, "I'm going to remove your bowel and your bladder." It's really, really frightening. That's the nightmare I continue to have.
Right.
Recurring nightmare.
Wow. Yeah. 'Cause
Yeah.
that's incredibly invasive.
Yeah, because people think,
Mm-hmm.
oh, constipation, I don't really want to talk about that. How serious can it be? Really serious.
Right.
Yeah. Yeah.
And very prominent in the pain community. Prevalent, I should say.
Wow. Okay. Okay.
Are you
well,
okay,
great.
Deanna?
Yeah. I'm just it's and people. The thing that I'm kind of amazed about is people have no idea that it's that severe.
No idea. I
yeah.
mean, I've been suffering from OIC for 20 years, and I didn't even find out there was a name for it or that it was caused by opioids until this year. So people
Wow.
who are dealing with it very often don't understand that it may be a complication of their pain therapy.
Yeah.
That's why we're having this conversation today.
Exactly.
Yeah.
That's what it is.
Yeah.
Okay. Well, what advice do you have for those who might be experiencing the OIC?
First, know that you're not alone. Through our nonprofit for Grace, we hear from people on a regular basis who are being treated with opioids and also dealing with the frustration and the pain of OIC, though they're not aware that this may be a result of their pain therapy. Also, please don't ever be embarrassed or ashamed of your OIC. This is a normal side effect of getting relief, and all of us with pain, we deserve relief. Remember that OIC is not normal constipation because it is caused by the opioids, and as I mentioned, at least for me, that makes it much more difficult to manage. And John and I always encourage people to have an open dialogue about all of their pain experiences, but especially OIC, because this can be embarrassing to talk about, at least at first. And please make that all-important appointment to talk to your doctor about this situation and start that OIC conversation.
Okay. And talk to your doctor.
You got
Indeed.
it. Indeed.
Okay. All right. Well, so John doesn't feel so left out. Here's a question for him. Do you have any caregiver tips for people who are caring for someone who has chronic pain or other conditions?
Yeah, well, it's my standard advice for caregivers of people with chronic pain or chronic illness is just realize it's a tough job. It's a tough job. It's one full of love and a lot of special things, but it is a tough job that you take on day to day. It's not going to go away anytime soon, but and as such, it's something. I call it a marathon. This baby is not a sprint. It's a marathon. So you need to invest in yourself as a caregiver, because the care you're going to give is only as good as how you're feeling. And if you're not feeling good, the care that you're giving is not going to be very good. So you got to take care of yourself, manage your own stress, eat right, exercise, meditate. All the things that are good for the person with chronic illness and chronic pain is good for you too. And be an advocate for them. Encourage open and honest discussion about all the problems they're going through, including OIC. And you know what? That includes yourself too. Be open with yourself and be open with your problems. Find somebody in your life that you can talk to pass, some of the challenges you're going on, and have an open, honest dialogue with them. That's be a champion for that person you're taking care of. When they go into the doctor's office, be in their corner and make sure they're talking about all the things they need to talk about, including OIC, and encourage them to speak up about it, because again, it's a serious condition, and but sometimes we hold back talking about it because it's maybe something we're a little ashamed of or maybe humiliated by, but it's nothing to be shameful about. It's something to take on.
Right, because it's not dinner time conversation. It's not what we like to talk about necessarily.
Yeah, right.
But it's essential.
Oh yeah, absolutely. It's just like sleeping. There's a lot of parts that go with chronic illness that need to be talked about for overall wellness. Sleeping is one of those things that people just don't give enough concern about. And our digestive system is definitely way up on the list of things that you need to take care of and to manage.
Okay, and you did say something earlier. You said you're only as good as your caregiver. What was that quote again?
I'm sorry. I mean, in terms of caregiving, the quality of care you give is only as good as the energy and life force that you have in yourself to give. You know what I mean? You need to be rested and nurtured of yourself to give that best care you can.
John meditates every day, which is really good, or he just breathes deeply, when things get really tough. I notice you doing that now because you told me about it.
Or a good laugh.
Really helps him. Or laughter, yeah, true.
Okay, all right. So that was, okay, so we are on question 6, and that is, and could be for either Cynthia or John, where can people suffering from OIC get more information?
Our nonprofit organization, For Grace, provides information about OIC as well as information and resources for women suffering with chronic pain. And our website address is www.forgrace.org. I took that
.org,
one.
not .com.
You're right. It's a
.org.
nonprofit organization.
Right. Okay. Okay. Yeah. That's good.
Great.
Good. All right. So question 7. This is actually for John, and it says you cared for Cynthia for more than 30 years. So, and you kind of touched on this, but it says, what advice can you provide to caregivers who might be caring for a loved one in a similar situation? And I guess you did touch on this, but if there's anything you want to reiterate, that's fine too.
Well, sure, Dan. Again, the thing to emphasize is to be that champion for the person you're taking care of, to be that advocate, to sometimes be that voice, to speak up when sometimes they've forgotten to speak about something that's concerning them or their condition. They've got a lot of things on their mind. They've got a litany of things they've got to address, and they're in pain. And pain doesn't, produce the best thinking, you know, so at times. So you want to be there, you want to be that person that keeps their main concerns at hand, and so when you go into that doctor's office or the health care provider's office, is to encourage them to speak up and talk about the problems, a problem like OIC, and see what solutions there are. There are strength in numbers, and that's to encourage them to talk about all aspects of the pain experience.
Okay, perfect. All right, and we just have a few more questions, so I won't take too much more of your time.
Great, thank you.
Sure, and this question's for Cynthia.
Okay.
What can you tell me about your book, Battle for Grace, a memoir of pain, redemption, and impossible love?
Wow, it's a roller coaster ride. It is very raw. There were some things that John didn't want me to talk about or write about in that book, but it's the real chronic pain experience. And I had John actually do John's take at the end of every chapter with his perspective, and that was really interesting. We're getting great feedback about it. People say that they're choosing to continue on with their journey because if I could make it, they could. So it was a very healing experience, and that narrative therapy is the reason I went into my first and 27-year partial CRIPS remission. So I appreciate that question.
Okay,
Yeah.
good. Perfect. Very healing experience. I can see that.
I didn't know that narrative therapy could literally bring me to wellness, and it did. Totally unexpected. I think it was reliving it. It was sort of like, incredible psychotherapy and also couple therapy, really. We discovered so much about our lives, and we figured we'd sort of put the whole, the pieces to our puzzle together through writing Battle for Grace.
Fascinating process.
Yeah.
Okay.
I recommend it to anybody, everybody.
Wow. Okay. All right. So here's one more.
Okay.
And this is for Cynthia. And if you want to retouch on this a little bit, that's fine.
Okay.
But what does forgrace.org do for the community?
Well, we promote better care and wellness for women in pain, and we do our work through the media, public speaking. We do a lot of legislation. We have events. We have support groups, our website, on and on. It's kind of insanely busy work, but it's very rewarding because we get to really help people. And our tag is a dream of never again. We don't ever want what happened to us to happen to any other couple. So that's what we're doing every day, making sure that doesn't happen.
Absolutely.
And it's very rewarding we named for Grace after the little girl that John and I wanted to have a name, Grace. And on Mother's Day, we hear from people who say, we got saved because of you, and we named our little girl Grace. So quite a lovely, rewarding work.